Introduction. Diabetes is a chronic health condition that affects millions of people worldwide. Although lifestyle modifications such as diet and exercise can help manage diabetes, medications are also an important part of treatment. In this article, we will discuss the different types of medications used to manage diabetes, how they work to control blood glucose levels, and the potential side effects associated with their use. Types of medications used to manage diabetes. There are several classes of medications used to manage diabetes, including insulin. Insulin is a hormone produced by the pancreas that regulates blood glucose levels. People with type 1 diabetes do not produce insulin, and those with type 2 diabetes may have decreased insulin production or insulin resistance. Insulin is usually given through injections or an insulin pump. Metformin. Metformin is an oral medication that reduces glucose production in the liver and improves insulin sensitivity. It is often the first medication prescribed for people with type 2 diabetes. Sulfonylureas. Sulfonylureas are a class of oral medications that stimulate insulin production in the pancreas. They are often used in combination with metformin for people with type 2 diabetes. GLP-1 receptor agonists. GLP-1 receptor agonists are injectable medications that stimulate insulin production and reduce glucose production in the liver. They also promote weight loss and have been shown to reduce the risk of cardiovascular events in people with type 2 diabetes. DPP-4 inhibitors. DPP-4 inhibitors are oral medications that increase insulin secretion and decrease glucose production in the liver. They are often used in combination with other diabetes medications. How medications work to control blood glucose levels. The different classes of medications work in various ways to control blood glucose levels. Insulin lowers blood glucose levels by transporting glucose from the bloodstream into cells where it can be used for energy or stored for later use. Metformin reduces glucose production in the liver, and sulfonylureas stimulate insulin production in the pancreas. GLP-1 receptor agonists and DPP-4 inhibitors both increase insulin secretion and decrease glucose production in the liver. Potential side effects of diabetes medications. All diabetes medications have the potential to cause side effects. Some of the most common side effects associated with diabetes medications include hypoglycemia. Hypoglycemia, or low blood glucose levels, is a potential side effect of insulin and sulfonylureas. Symptoms may include shakiness, dizziness, sweating, and confusion. Gastrointestinal issues. Metformin and GLP-1 receptor agonists may cause gastrointestinal issues such as nausea, vomiting, and diarrhea. Weight gain. Some diabetes medications, such as sulfonylureas, may cause weight gain. Pancreatitis. GLP-1 receptor agonists have been associated with an increased risk of pancreatitis, a condition in which the pancreas becomes inflamed. Cardiovascular events. While GLP-1 receptor agonists have been shown to reduce the risk of cardiovascular events in people with type 2 diabetes, some studies have suggested an increased risk of cardiovascular events with DPP-4 inhibitors. Conclusion. Medications are an important part of diabetes management for many people. While they can effectively lower blood glucose levels, they also have the potential to cause side effects. It is important to work closely with a healthcare provider to determine the best medications and dosages for individual needs and to closely monitor blood glucose levels and any potential side effects. Introduction. Diabetes is a chronic health condition that